Within the Supporting Carers Action Guide for GPs and their teams, which are these couple of booklets that hopefully some of the surgeries might have accessed with a DVD. If you haven't yet, I think you're going to be able to access these. They've been developed jointly by the Princess Royal Trust for Carers and the Royal College of General Practitioners. Professor Nigel Sparrow states in his introduction, "The relationship between carer and GP practice is a special one and should be recognised as a partnership in care. GPs and our colleagues in the primary healthcare team can support carers by making them aware of their own health needs, supporting them emotionally and practically, and providing useful information. An estimated 10% of a practice population are carers, and there are many more hidden carers who, for one reason or another, are not getting the services and support they need. GP surgery staff are in a really good position to help us identify hidden carers." We've actually got a printout, I think, over here as well, and it's certainly in this book, which is a quick, easy guide to look at how many numbers you have in your practice and therefore how many carers that you would possibly have coming to your practice. Carers are estimated to save the UK economy £119 billion a year in care costs. This is equivalent to over £18,000 per year for every carer in the UK, and that came from a research project only done last year. The Princess Royal Trust for Carers Health Strategy in 2004 stated that 10% of carers put their high blood pressure down to the stress of caring, and 20% reported back injury as a result of caring.
Thank you, Chris. I'd like now just to talk a little bit more about the scheme. I'm going to introduce it by using an introduction that was in the original pack. There's a lot of history to the scheme, and way back, Susan Lambert from NHS Wiltshire was very much involved with the setting up of the scheme, and her introduction said, "The aim of Wiltshire Investors and Carers is to raise awareness of work already being undertaken to support carers in GP practices in Wiltshire and to encourage further development work. The idea of having an attainment scheme was first developed by the Ceredigion Carers Alliance. This scheme for Wiltshire has been developed locally in Wiltshire by local carers, members of voluntary agencies such as Carer Support, a number of GP surgeries, and members of NHS Wiltshire and Wiltshire Council. There are 3 levels of attainments: bronze, silver and gold, with a practice having to qualify for bronze level before progressing to the 2 higher levels. If you've come from a GP practice, you will have received a pack outlining the criteria for the levels. These should be self-explanatory, but Chris, Sarah and I will be available afterwards to answer any questions you have or clarify anything you're not sure of. Indeed, throughout the following year, we will be prepared to meet with practice staff and assist you with fulfilling the criteria. For the reasons Chris has outlined, we are committed to supporting you to achieve the levels. We know this benefits carers. So just a few words on the process of administering the scheme. Recognising how busy surgeries are, we have included a checklist for you to complete during the year, as and when you fulfil the criteria. We have provided examples of evidence you will also need to show us. Once you have completed these, you may inform us at Carer Support Wiltshire. There's an accreditation panel comprising carers and members of patient participation groups. Your checklists and accompanying evidence will be submitted to the panel in April 2013. Certificates will be awarded during Carers Week in June of that year. We're aware that some surgeries are already achieving a great deal in their support to carers and may already be operating at a gold level. We feel it is important to recognise these. In these instances, it may be possible to achieve all 3 levels in one go. Conversely, some surgeries may hold a clinic which we would consider a gold standard activity, but not have achieved all the criteria for bronze and silver. we would need these to be demonstrated and awarded accordingly before aiming for gold. The gold level is not prescribed and is merely looking for a surgery's own innovative approach to supporting carers. However, one example, as mentioned, of the type of activity is the carers' clinics, and Chris will explain about these.
Yes, at Carer Support Wiltshire, we've worked with various GP surgeries in setting up and facilitating carers' clinics. We have now secured NHS and Wiltshire Council funding, which is overseen by Wiltshire Council, to continue and expand this work into all 60 GP practices across Wiltshire, with an aim of 3 carers' clinics in each surgery annually. We will endeavour to work flexibly, offering to meet with each surgery individually to ensure that the carers' clinics meets each surgery's needs. Typically, at present, we see approximately 10 carers per clinic, and they have a 10-minute appointment with a practice nurse and then a 10-minute appointment with a carer support worker. The practice nurse is able to provide a general health check and identify any health issues that may need further treatment. The carer support worker is able to explain the service available, deal with any specific issues, signpost and provide further support at a later date. We have previously also been able to provide appointments with a benefit advisor and hope to be able to offer this again in the future.